it is called a policeman. يعني اسمها الآخر يسموها waiter tip position or policeman policeman tip position. It is called Erb's palsy. هاي clinical term أنا أريد Erb's palsy صراحة, but these are two terms also should be known. When we talk about the Erb's palsy, we mean that it is an upper trunk injury. I mean there is injury to C5 and C6. يعني كنا نعرف إنه الupper trunk هسه عرفناه هو متكون من C5 and C6. So what will happen if C5, C6? The baby طبعا usually it will be occurred if مثل ما نقول إنه مثلا when he falls down or when he hangs up on a tree, something like that, راح ينطيني هذا الانجري الموجود. But look at the position of the upper limb of the baby. We'll find that his shoulder is adducted and internally rotated. The elbow is extended and pronated, and his wrist is flexed. Okay. Asymmetrical Moro's reflex. هاي احنا Moro reflex is one of the reflexes which are present in the newborn baby. And here, when we throw him, he will give an reflex which is called the Moro reflex. فراح ينطيني asymmetrical Moro reflex. مو كلش بالنسبة لي أركز عليها, بينما anatomically the position of the upper limb is important. Adducted shoulder internally rotated and the elbow extended pronated with the flexed wrist. This is called Erb's palsy. One of the injuries that could occur to brachial plexus during labor, if the head is pulled in a way very strongly, we could damage to the brachial plexus could occur. This is Erb's palsy. هذا هنا نفسه هذا البوزيشن هسه لقيناه. We have another brachial plexus injury which is called Klumpke Palsy. Klumpke Palsy اللي هو also we call it the claw hand. It is also called the claw hand palsy مثل ما تشوفوا. This is injury to the lower trunk يعني to C8 and T1. هاي Klumpke's palsy. Lower trunk injury. This usually occurs شوف هنا مثلا during birth مو الهيد اللي طلع الهاند الارم upper limb and they pull the upper limb. When they pull it they could lead to a lower trunk injury أو مثل ما تشوف one is hanged on a tree. This also can يعني a sudden superior pull of the upper limb. This also can lead to an injury to this trunk. As we said, it is injured to C8 and T1, and طبعا this clinically we will have the muscles which are paralyzed are the small muscles of the hand, the intrinsic muscles of the hand, so that's why it gives us a deformity of the claw hand. claw hand يعني مثل المخلب, ينطيني الهاند will be بالضبط يصير مثل المخلب. اللي يهمني anatomically إنه أنت تعرف إنه there was an extension of the metacarpophalangeal joint with a flexion of the interphalangeal joints. Okay, أعيدها. يعني الكلو hand من نجي نسأل anatomically what is a claw hand, you will find that it is extension of the metacarpophalangeal joint with a flexion of the interphalangeal joints, especially of the ring and the little finger, especially يعني لأنه C8 and T1 is injured. هذا شوف حبيبي هذا النونو هذا عنده claw hand. Okay. طبعا in addition this is due to the motor paralysis that occurred. There is also a sensory يعني sensory مثل ما نقول involvement also to the hand. بعدين من نشرح ulnar nerve والmedial نشرح distribution of the sensation to the hand. So there will be loss of grasp reflex. Grasp reflex اللي هو روح على أي نونو هسه وروح الزم إصبعه, immediately he will grasp your finger. So in Klumpke palsy there will be loss of the grasp reflex and the hand will be supinated, the wrist extended and the fingers are closed. هذا بالضبط هو شكل Klumpke's palsy. Okay. طبعا هنا أكو فد من راح تقرأ بالمحاضرة يقول لك involvement of T1 may result in Horner's syndrome. حتى to be aware about what is written here, we all know, and this is my interest, they all know that I love the autonomic nervous system. The sympathetic system in our body starts from the level of T1, okay, to إلى lumbar, to the L, إلى ال L1 يكون distribution. This is the origin يكون of the sympathetic system. So because of the involvement of the lower trunk اللي هو C8 and T1, طبعا أنا إذا أسأل سؤال أقول are these spinal nerves carrying sensory and motor؟ احنا قلنا it is mixed. Yes, it carries sensory and motor, but does it carry sympathetic fibers with it? Yes. يعني كنا نعرف إنه spinal nerves have sensory fibers, have fibers from the sympathetic in order to be reached to the muscle and its arterial supply حتى يشتغل عندنا الأوتونوميك. شو وقت يزيد للبلد سبلاي، شو وقت يقلل له البلد سبلاي، التون مال المسل شلون ممكن إنه يكون. فهذا كلش distribution of the sympathetic within the spinal nerves. So in order to know what is Horner's syndrome, it is an involvement of the sympathetic system. So it will be contributed يعني with ptosis. Ptosis يعني الليد الupper eyelid راح تنخفض ثيجي يعني تصير نازلة، ومايوسيس اللي هو معناها constriction of the pupil. These two are sympathetic innervated, لذلك they are involved in this could be involved in this palsy. Okay. يعني واللي عنده سؤال على الموضوع يقدر يراسلني وأفهمه عليها أكثر، خصوصا أنتم صف أول شوية ما عندكم ذاك المعرفة عن الأوتونوميك نيرفس سيستم بهالطريقة هذه. بس you should be aware about this is a clinical another clinical anatomy or condition which is called the winged scapula. Winged scapula, we all know one of the muscles that is present on the whole medial border of the scapula is the serratus anterior. serratus anterior واحدة من العضلات اللي موجودة، وكنا نعرف إنه it has digitations, a lot of digitations. It is supplied by the long thoracic nerve. So when the long thoracic nerve is injured, it will give me this clinical condition اللي هو when I ask the patient to push the wall, for example، يعني أحطه باتجاه الحائط وأقول له ادفع against the wall. من يجي يدفع راح نشوف one of the or the injured side راح يكون بالضبط بهالشكل هذا، كأنما سكابيولا مجنحة، لأنه السريتس anterior is paralyzed فما تلزمها بمكانها. It will not put the scapula as here, as we see here. It is normal. It has its normal position, but here it is winged. So we call it unilateral wing scapula. This means there is an injury to this side, to the long thoracic nerve. طبعا if it is bilateral, we have bilateral long thoracic nerve injury. If it is unilateral, unilateral. So the winged scapula is for long thoracic nerve injury. This is another view حتى نراويكم السريتس anterior شلون يروح ويسوي insertion to the medial border of the scapula, and it anchors the scapula against the rib cage. Another palsy or injury that could occur to the radial nerve فراح نسميه Saturday night palsy. It is called Saturday night لأنه in the West العطلة مالتهم سبت وأحد وهالسوالف. They go to clubs and they get drunken, and when they sit on the chair بهالشكل هذا, prolonged sitting on the chair or sleeping, there will have a crush or a stretch or an injury to the radial nerve, giving him a palsy which is called the Saturday night palsy. الراديال nerve هو واحد من النيرفز اللي من هسه أقول لك إياها the whole posterior compartment of the upper limb depend on it, يعتمد عليه، فراح يطلع عندنا بالضبط هذا البوزيشن اللي هو يسموه Saturday night palsy. هذه another picture of it. ها طبعا شوفها شلون عندنا هاي شي يصير عنده حالة، يصير عنده حالة نسميها the wrist drop. the wrist drop بالضبط يصير عنده wrist drop، يوقع الإيد مالته، لأنه كل الإكستنسرات اللي موجودة will be affected. هاي يعني حتى أتذكر جبناها مرة بالامتحان العملي، أشرنا على الراديال نيرف وكتبنا، أو ما أشرنا على الراديال نيرف، قلنا wrist drop is an injury to which nerve، فأنت لازم تعرف إنه to the radial nerve. The axillary nerve is also one of the branches of the brachial plexus. It is very important, has a close relation to the third part of the axillary artery, and the axillary nerve آخر شيء طبعا it supplies the deltoid and the teres minor muscles, and آخر شيء it will end as a lateral cutaneous nerve of the arm. So it passes through the quadrangular space اللي موجود between the muscles at the axillary region. If it is damaged، طبعا احنا كنا نعرف انه the deltoid is one of the main abductors of the shoulder joint, so it will damage the abduction to a certain level or degree, and also it will affect the sensation on the upper lateral part of the shoulder. أشرنا بوقتها على مكان موجود على shoulder distribution of C5 and C6، وكتبنا if this area is paresthesia يعني ما يحس بها هذه الاريا which nerve is damaged، فنقول the axillary nerve injury occurred. We all know، يعني أعتقد قايلتها قبل وسأكد عليها إنه the initiation of the abduction of the shoulder joint is done by supraspinatus muscle, but to an angle, but then it is completed by the deltoid, which is the main abductor of the shoulder joint. This is the axillary nerve. هاي حلوة الصورة أنا أحبها لأنه نجيبها on the neck of the humerus. باوع على neck of the humerus هنا نرسم لك مثلا nerve ونقول which nerve is present here. تقول الأكسيلاري nerve لأنه it will be divided to the anterior division and the posterior division، وكله closely related to the surgical neck of the humerus. Surgical neck of the humerus. Okay. هذه هي السensation، هذه الاريا of the sensation of the axillary nerve، upper lateral part of the upper limb. تمام. اوكي، الماسكولوكيتينيوس نيرف مدام هي موجوده بالصوره خلينا نقول من نريد نجيبها it pierces the coracobrachialis muscle، يعني نجيبها انه مخترقه الكوروكوبراكيالس muscle، ونجيب لك اياها ماسكولوكيتينيوس من اسمه ويغذي most of the flexor compartment of the arm. اوكي، وحتى اقول لك اياها it supplies BBC اللي هي biceps brachialis and coracobrachialis، يجي تحفظوها. musculocutaneous supplies the BBC. زين. Important to know, as you see, that the axillary nerve at the region of the surgical neck of the humerus is accompanied by the posterior circumflex artery. Posterior circumflex artery is accompanied by the axillary nerve. Relation is important، يعني نسأل نقول منو accompany ويا الأكسيلاري nerve، نقول posterior circumflex humeral artery. This is the condition where wasting of the muscle occurs. Now we have a wasting. musculocutaneous nerve هاي أكدنا عليها إنه it pierces the coracobrachialis or supplies BBC. Okay. It ends by becoming the lateral cutaneous nerve of the forearm. I think we will end here لأنه we talked about the brachial plexus, and I want in another lecture to talk about each nerve of يعني its branches with its distribution. So by summary, I can say that the brachial plexus level is important. Its roots, trunks, cords, and divisions is important to know with its branches. You should memorize them. memorize its spinal levels also with its clinical anatomy. Thank you for now.